Hello, my name is Dr. Lea Njogu. I'm a cosmetic dentist. I work with Ruby Smiles Dental Clinic. Today I want to talk about the early signs, the warning signs of dental disease, something that will make you think or know that maybe this is a dental issue and you're able to handle it as early enough before it becomes something more serious. Dental problems does not necessarily present with such big issues initially. You don't have to not have slept the night before or to be in so much pain or your head is hurting or you cannot even sleep at night for you to know there's dental problems. Most times it's a chronic issue, it's an ongoing issue. For dental disease to get to a point that you're in so much pain or it's such a big deal, it has most likely been going on for a while, and most of the time there's been small things that have been happening, some small signs that you've been ignoring that would have made you know this is an issue here. And that is what we're going to discuss today. The reason why it's important to know these signs before is because sometimes it saves on cost. Some procedures, when done very early enough, will be not so costly, like if you require filling versus having to go all the way to a root canal. Before you need a root canal, you possibly at some point needed a peeling. It never just comes as one thing. So the cost implications, it's always, if you do the procedures early enough, you might save you some money. Number two, some things are irreversible. Like when you're talking about gum disease and your teeth start getting so loose, you come into the dentist and sometimes our only option is maybe to extract this tooth. Maybe this tooth has been eaten down by cavities, and then the only option I have as a dentist is to extract it. So sometimes you end up losing a tooth or spending so much money or other repercussions that might not be warranted if you came to the dentist early enough. So what are some of the things that you might make you know there's something that is going something off with your mouth, and maybe at this point I need to visit a dentist? The first thing to watch out for is bad breath. Bad breath is always an indicator there's something going on. Something, you should not be walking around with bad breath saying, oh, my teeth just smell this. Possibly there could be indicator of cavities or gum disease or whatever. So if you're not comfortable with how your breath is, possibly visit a dentist, and then we can be able to determine what is causing this bad breath. The second thing is sensitivity. If you're experiencing sensitivity constantly, or sometimes you're eating and you're like, you experience sensitivity for like 5 to 10 minutes, or it's persistent and maybe not yet up to the level of pain, but nagging sensitivity, you might want to visit a dentist and see what is causing that. The third thing is bleeding gums. Bleeding gums is mostly an indicator of gum disease. So you want to find you want to mitigate this before it gets to a level that you have tartar or you have more serious than gum disease. So the minute you start spotting bleeding gums, you should visit a dentist at that point. The other thing that might be cause of concern is cavities. It doesn't have to be painful necessarily, but you might be looking at the mirror and you're like, there's a cavity there. Whether it's painful or not, it would be a good point to visit the dentist. Conjunction with the dentist and your physician, you can actually always find a way on how to handle those issues. But that has to be done under proper diagnosis, and most of the time you can see if some medications can be replaced and such things. So it is imperative to have the dentist in mind when you are experiencing these bleeding disorders. As I mentioned, it's imperative to have your teeth cleaned at least once or twice a year. If you're in need of this cleaning, you can visit us at our clinic. We are conveniently located in Pangani off Juja Road, or message us or reach us out to any of our social media platforms.